Hi everybody, my name is Taylor Green. I'm one of the audiologists here at Audiology Associates.
My name is Rhys and the other audiologist here at Audiology Associates. So we've got 3 patients in this compilation for you today, guys. Starts with me, then Taylor, then me again. I've got mixtures of, foreign body, wax, long plugs, skin, everything in it today for you guys.
Like a foreign body.
I like a foreign body. It just mixes things up a little bit, doesn't it? So you can see we've got this really long plug. Look at that bad boy. That is out to the first ear canal here, so a really long plug there. And you can see the eardrum there looking nice and healthy. Just a little kind of tidy up just going on the outside there, just a little few bits of skin. I know, just starting to lift and peel. And then it just peels and then peels some more.
As it usually does.
Oh, I know. So lots and lots of skin on this one. Just peeling that away. But the plug came away really well. Patient was really surprised at how big that plug was when it came out the ear canal, I've got to be honest.
Not surprised.
I know. It was chunky.
Is that a regular patient then, or was that?
I think this was the first time I'd seen this particular patient. Yeah, okay. It was the new one for us. Lovely lady though, she's really nice, but I was complaining that things were feeling blocked up. Yeah. And I think this is the patient where I've got the foreign body on the other side, and I looked at it, I was like, oh, okay, there's something in here.
What is that?
Yeah. So you can
Do you wear here?
So you can see a little bit of vibration then on the end, so there's a little bit of clarinetting there. So I've just come back, I just want to have a little look at this top section. There you go, that's the bit I wanted to see if I could peel. Look at that. I know.
Well.
There's a long hair as well that came off the top there. It's actually gone into the suction. You can see now how far down you get, and then you hit this little bit of resistance. And that bit of resistance there is just where the skin is not quite ready to come away yet. So we'll stop there. So there you go. There's the foreign body. It looks a bit like a polo mint inside the ear canal there. That's actually a filter from a hearing aid. So I looked at it, I was like, oh, at first glance, I thought it was a grommet. And then I was like, oh, have you ever had grommets? And she was like, no. I was like, all right, do you wear hearing aids? She was like, yeah. I was like, oh, there we go. That's what it is. That's what it is. So, yeah, the daughter was the daughter came at the appointment as well. She was like, oh, what? I don't understand what that is. So I was trying to show her on a hearing aid. Yeah. Makes it a bit more awkward because you get this kind of hole in the middle. Not easy to get a good grip on, unfortunately, because they're obviously designed to let sound through and block wax and stop it from going through. So it just didn't really budge.
Might have been better, like if that was twisted the other way. Yeah, the smaller side.
You've got it. That would have been so much easier to get out. I'll give you a good look at it. There you go. So you can see a little mesh on the inside that stops the wax from getting past.
I mean, it's technically done its job, but it's just stayed.
Yeah, exactly. Yeah.
It's just stayed in it. Big block of wax on the back end of it.
So a lovely peel now for this last bit. A little bit of dry skin, dry wax coming away. I know. I probably could have put a bit of oil in now looking at that, thinking about it, but it's peeled the majority of it there.
Don't really want to risk the patient hearing, worse than when we've done.
Yeah, because sometimes the wax will go right down, and we've got to try and get rid of that then to get the patient hearing better. But lots of dry skin, but all coming away nicely. There we go.
Oh, nice and
that's looking
nice
good.
Pearly little not little eardrum, but you know what I mean. Nice pearly looking eardrum.
The filter way it looks like that you probably want. Do you ever used to watch something called The Mighty Boosh?
Yeah.
Yeah. There was a character in The Mighty Boosh that had that big white eye. Do you remember that? I can't remember what it was called. I loved it.
All Greg.
All Greg.
I'm all Greg.
Oh, Greg. I suppose all green with seaweed for hair. Yeah. That's right. Yeah, I do love Noel Fielder. There was, weirdly, we were at, I took Theo to, I'll tell you after, because I'll talk over yours.
Pretty much done already. But
I know, check. How come you get that?
It's come away really nicely to me. This looked like it was going to be a lot harder to remove, to be completely honest, because it kind of looked a little bit wet in a way, and I thought it was going to leave a load of mushed in there, but that's come away really cleanly.
That's nice.
Yeah, I could see there was a little bit
humidity there. Taking the moisture out.
Just to try and get a better look. You will see us occasionally kind of doing that, just putting the suction tube in, not really grabbing anything. That's just to take away all this moisture.
That is dry, Taylor Green.
Completely opposite on this one. So there is a gap there. So, the patient's hearing okay, but just itching, just really irritating. Patient could feel something in there and just knew that it was wax. But look how like firmly like glued that is to the ear canal.
You want that rolled when you're at the front.
That's exactly what I'm trying to do. Want to see. Trying to get the front little lip of it just to see how loose it is, and oh, there it comes. That's what I'm looking for. Come drop back a little bit now. Try and get that a little bit near the entrance.
Oh, there we go. Let's go in.
Starting to move.
Yeah. Ideally, you want it to kind of peel the rest of the way around.
Yeah.
That's
what I'm hoping for. As I'm loosening this off, I'm hoping that back end is quite loose.
Yeah.
And I don't want it to come away in little bits, because that could be a bit of a nightmare. I'm just trying to putting it to the side here now, but hair right in the middle of the camera. So
I know, you can see.
Should have gone a bit further.
Thing is, when you've got a good grip and you're kind of working on it as close as you are at the canal wall there, you're kind of loath to move the endoscope, because you've got a really good kind of view. I don't see them sometimes. I
was just going to say, I know it sounds really silly, but because you're focusing on what you're doing and where you're going, you don't even see them half the time. They're so blurred, you don't really tend to see them coming on the camera, unless there's oil on there, and you get a little bit on the camera, everything goes blurry then.
Forceps?
I think I do. Not yet. I'm going to peel that a little bit away first. I'm pretty sure
Look at that.
I could have sworn I used a pair of forceps in this one. Oh.
It's got that kind of edge for foot. Oh, I don't know if it does actually. That's just peeled away really
easy.
Yeah.
Do I?
No.
I can see that bit that I'm getting now, that's what I would grab with the forceps. But
perhaps it was the consistency when you took it away the last bit, because it was softer than I thought it was going to be actually.
Yeah, a couple of little bits left there now on the sides. Put the fine end on for this now,
I
think.
These usually take a lot longer than the wax removal bit, the main bulk of the wax removal, don't they? Take these little bits off the side.
I think we got lucky with these. I think they were relatively
that's
loose.
not bad.
They were just coming away little bits.
Fair play.
But it's looking healthy though, so the eardrum you can see is looking good.
Nearly.
Can't believe a crow closing into Christmas already.
Waxford will be honest before we know it now, guys. If you're new to the channel, by the way, and you've never seen Waxford, is our little gift to everybody for being members and subscribers all throughout the year. So what we do is we put a video out every single day in December, right from day 1 up to day 24. So you get what we call the Waxford calendar. So you open a new door every single day for a new wax removal video, and we save some of the best and longest ones we've done all throughout the year. We don't show you everything, see guys, we hold some stuff back for Christmas, which means it's a mammoth voiceover task for us, isn't it? That's a long, because you're talking, I think one of them is like 25 minutes, 26 minutes long. So yeah, there's a lot for us to talk about over Christmas. So a lot of editing for us to do as well. So that's coming up.
And a lot of missing voices as well.
Yes, yeah.
You'll be coming in and we'll be talking like this.
I'm Batman. It's that kind of thing. You got, where your voice kind of goes after a little while. There
you go, just getting these last little bits now. As Rhys said, these little bits, they always take the longest when they come away in little tiny bits like this. There you go, there's another one. There's one more at the bottom. Yeah.
I reckon you're going to hit this one in top left. That piece on the left hand side. Knew it, look, see. Could tell, knew it. Do you go to the right then? Or do you leave it that? I think you're going to leave it. Oh, you went left.
I got a little bit of it away. But
you did, yeah.
It's this, again, if you've not seen the channel before, that area that you just seen in front of the eardrum is very, very sensitive. It's basically a layer of skin on bones. We're inside your skull. Yeah. So as you can imagine, anytime we touch that with a metal tube, it's can be quite uncomfortable. Yeah. So we've got to be extra cautious when we're in the ear. This is back to you now.
Back to me, yeah.
So back to Rhys.
Talking about skin, this is actually a skin blockage here. So we can see these layers of skin that have all kind of collected at the entrance to the canal. So we talk about this epithelial migration. We talk about this a lot, the movement of the skin inside the ear canal. And what's happened here is in this particular patient, it's migrating really, really well, but it's not breaking away when it gets to the entrance to the canal. What we're left with then is this thick skin layer that's all kind of closing in from all sides on the outer portion of the ear canal, this dry keratin skin. But yeah, it's coming away really, really well. Look at that.
There's not much you can do either, as you said.
No.
We get a lot of patients saying like, "Oh, how do I clean my ears? Like,
Yeah.
what do I do? What do I need to do?" Your ears are, to a certain degree, self-cleaning, so they will try and clean themselves out, but it would be more a case of getting them checked more regularly rather than trying to do it yourself.
Yeah.
You know, there are some conditions and some pathologies in some patients that they just can't help it. You know, some people get repeated infections, which needs clearing every 3 to 6 months.
Yep.
And yeah, it's a tricky one. Just don't stick nothing in there because you're going to make it worse.
Yeah, definitely. I mean, you can obviously, if your ear canals are intact, your eardrums are intact, you don't suffer with ear infections a lot. You can put a little bit of olive oil in, and that can sometimes help the skin and wax to kind of migrate out and keep it nice and soft, so it works its way out the canal a bit better. But most of the time, you just leave well alone, and it will clear itself out. It tends to cause more problems as we age. So, as you get into your kind of 60s, you're far more likely to get problems with wax build up. So, definitely as we get a little bit older, getting into good habits when you're younger, using a bit of olive oil on a regular basis does make a big old difference, especially as we get older as well, where we don't produce as much oil. So it does big. So the last little bit coming away. Here we are. So I want to try and get past that bit to get past. There's a little bit of skin at the entrance to get that last deeper bit, because otherwise that skin would have kept jumping up in front of the suction tube all the time. I can see I'm trying to get the angle here. Am I going to go for a lift or a pull? Or a bit of both.
Yeah. Do you get forceps on that? No.
Well, I was thinking about it. I was sort of, but it did clip away. Well, that was fine. Eardrum looks lovely and healthy.
Yeah, perfect.
1/2 inch.
Yeah, 1.5 centimeters.
Yeah, well, guys, if you do enjoy the videos, you can always check, and you're watching this on YouTube, you can check out the recommendation that comes up in the corner by there. One of the corners, can't remember which one. If I'm on that side, I think it's over there. But anyway, you'll see it. Just click on that and you can have a look. It'll be another video that you guys will probably be interested in. And guys, if you do enjoy the videos, if you wouldn't mind liking, sharing, following, subscribe, heart, whichever one you do on your respective social media channel, that would be absolutely fab. And if you really, really enjoy the videos, you can also consider becoming members of the channel and get even more videos every single week. But until next time, guys, as always, take care of yourselves.
Take care of your ears.
And take care of one another, and myself and the lovely Mr. Taylor Green. We'll see you again real soon. Bye, everybody.
Bye, everyone.